are you? It is Dr. Emily, functional podiatrist and human movement specialist, here to talk to you about walking like a duck. Now, do you ever notice that some of your clients, maybe patients, or even you, walk with one or both of your feet turned out? Now, there's different reasons of why people walk with their feet turned out. Could be coming from the hip, could be coming from the knee, and it could actually be coming from the foot itself. Now, what we're going to focus on today is the cause of walking with your feet turned out as it relates to the knee joint. So this is going to be referred to as tibial femoral external rotation. Sometimes people call this external tibial torsion. So this is what's happening. So when you are standing up, if you happen to notice that the knees are facing forward and the feet are turned out. So if you can see kind of my alignment here, do you see how my knees are forward but my feet are turning out? That means that when I walk, I'm going to start to kind of pick up my foot like this. You'll actually see this when someone is walking, is that they're going to look like they're taking a nice step, and then they pick up that back foot and they go like this, and then they swing it through and put that foot back down. That is a classic functional tibial femoral external rotation. Now your clients could look completely rectus and neutral, and as soon as you start walking, you're picking your feet up like this every time you walk. Okay, that's happening here at the knee joint. Now, the three muscles that are commonly associated with this is going to be your lateral gatroc, your bicep femoris, so that lateral hamstring, and then going all the way up into your TFL. So TFL anterior hip, coming down to your lateral hamstring, your bicep femoris, and then going into your lateral gatroc. And you could almost feel those muscles. If I stand here and I do this every time with my knee, which is a normal motion of the knee, but if we do it too much or too dominant, then that's where we start walking kind of like an egg beater in a sense. So what we want to do to help correct and find balance, we don't want to think about reversing this, but we're trying to find balance in the knee joint, is going to be an inhibition of those three muscles, followed by a fun mobilization technique. So that release, I'm going to be using a rod here, but you could be on the floor using a kneel ball, lacrosse ball, foam roller, whatever technique that you want to be using. But we're here, and I'm going to do a little bit of a release to that lateral gatroc, getting in there. Maybe I want to pin it, move my ankles some, but I'm going to really focus here for several minutes. I'm then going to get into my hamstring, and I'm going to get over here into that bicep femoris lateral aspect, couple minutes there, and then follow that with a couple minutes of my TFL. Again, I'm using the stick. You could use any release tool. Several minutes, call it 5 minutes, touch those 3 points, get that SMR. We're then going to follow this with the mobilization technique. Now for this, we're going to be in a seated position. So I want you seated. We're not going to do this standing. We're not going to do this on the floor. I'm putting my foot on something that slides. So I can't have any sort of friction. I need something that's going to slide. So I actually have a postcard or something that was mailed that has a little bit of a gloss to it. I'm going to keep my femur in the position that it is. So I cannot move the femur. And if you look at my foot, you can actually see, do you see how I'm rotating my foot? I'm keeping my femur stable, but I'm rotating my foot. If I think about this as a clock, this is going to be 12 o'clock on my right leg, and I'm rotating it out to about 2 o'clock, and then I come back in. However, that's not what I want to do, or the person who has tibial femoral external rotation. I need to go internal. So my internal rotation, I'm going to start at 12 o'clock, and I'm going to keep my foot flat on the floor, and I'm probably only going to make it to about 11 o'clock. And then I go right back to my 12 o'clock. I'm going to go to 11 o'clock and then back to 12 o'clock. Now it's going to be a small movement, kind of like a rotator cuff exercise, small movement, but very important movement. And then we're here. Some key things you want to look at, very important. Femur is not moving. Foot is staying flat on the floor and on the plate or whatever it is that your foot is on. And then really important, as I go in, I cannot sickle my foot. Do you see how I just sickled my foot? My tibialis anterior just engaged, my post tib engaged. Can't do that. Stay on your tripod, stay with those digits long, straight, and flat, nice and easy to 11 o'clock, and then back to 12. Of course, you want to make this integrated, so I'm connecting my foot to the plate. I'm engaging my core, shh, and then bring it back. I always drive with that breath, shh, and then back. Nice, easy movement. Second one with this is now we're going to stay here, locking my femur in. I'm going to go straight out to 12 o'clock, go to 11 o'clock, and then here I'm pulling in. I can feel my semimembranosus, semitendinosus, and medial gastroc really engaging. And then I go back to 12 o'clock. Extend out, go to 11 o'clock, use the core, shh, and I pull back in, 12 o'clock. One more time, straight out, go to 11 o'clock, engage, shh, and then back. So I can really feel those muscles engaging, okay? Now as a recap, what we're looking at here, this kind of duck walk that relates to the going to be addressing through mobilization and SMR, lateral gastroc, lateral hamstring, TFL, release, 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 mobilize, immediately follow that with this mobilization technique. As you do this mobilization technique, we're focusing on the internal, tibial femoral internal rotation. Lock that femur, keep the foot on its tripod, keep those digits nice and engaged. Do not sickle the foot. Don't get into the post tib or into the tibialis anterior, and integrate it with the pelvic floor and your breath. Consistently doing this, especially when you start to have some symptoms, is going to create balance. Really not going to be reversing the way that someone is walking. We're always trying to find balance and relaxation and to pull someone away from this threshold of where they start to get symptoms. To learn more about functional movement of the lower extremity, please visit dremilyslickle.com. Stay barefoot strong.